So the future is looking a bit bright, is looking brighter. This is a recent addition to the chemotherapy market, which is making a big difference in particularly myxoid liposarcoma. We see a lot of these in the abdomen, retroperitoneal sarcomas, big sarcomas. This is probably unresectable. And this is a pretty well tolerated drug, just needs to be given once a month, little side effects, and in 90% of patients in this group, it controlled the tumour. In 65%, it shrunk it down, where previously we really haven't had a surgical, an effective treatment. So this is just recent advances in our sarcoma treatment, and this is probably going to be, it's been looked at in a number of other different histological subtypes as well. In osteosarcoma, we're seeing another compound, which we're seeing given to osteosarcoma patients, we're seeing the survival go up from 60 to 70%, from 60 and 70% up to another 10% better. So it's maybe not think it's a great leap, but if we're maybe getting 80% survival in this young age profile, we think that's quite significant. We're seeing giant cell tumor, another type of tumour that we see, which actually produces a compound which causes bone to be absorbed. And in that bone absorption, the tumour literally spreads into. And this is in the sacrum. And in the sacrum, it's very difficult to actually surgically treat this. And we're using this thing called denosumab, which works on this pathway. And we see a scan of the activity of the tumour. Seeing it after 13 weeks, it's almost turned off. And histologically, this is a histology slide. We're seeing lots of tumour here. 30 weeks later, the tumour's gone and new bone is being formed in its place. So now, most patients that we've got with unresectable giant cell tumour, we are now treating with this compound. So they've gone from surgery that would potentially make them paraplegic to having this, a well-tolerated treatment once a month. And it's our medical oncologist, who's a cell biologist, who's sort of leading us in Oxford and also nationally on the investigation of phase 3 trials on these new biological therapies. His particular interest is this thing called the IGFR antibody, which is an insulin growth factor, which has got and he's blocking this receptor with an antibody, and that stops all these intracellular processes which cause the cell to power and become unhealthy. And his big excitement is that in Ewing sarcoma, he's seeing fantastic responses in metastatic Ewing's patients. Big reductions in, these are patients who've had significant reductions in the amount of tumour they've got. Unfortunately, he's seeing some patients who aren't responding. These are the group that he's not responding. So you can't say that these are going to be active against one histological subtype. What you've got to work on then is that we've got to find out what the genetics of these tumours are, not just the histology. And then we'll know whether these new treatments are going to be effective against them. So rather than have a histologist in our meeting to tell us what it is and how it needs to be treated, we're going to have a geneticist. And so the genetics are going to be the thing that's going to determine whether these patients are going to be successfully treated with systemic treatment to hopefully improve the outcome. So just in summary, sarcomas are rare, but they're unfortunately across the age range. Early detection and referral improves outcome, which I hope I've emphasised with those sort of staggering graphs about the size. Treatment does require quite extensive MGT of different experts in the anatomical areas. Oncological and reconstruction are twin surgical aims. There's numerous and varied reconstruction options available to us, particularly in the specialist orthopedic hospital. The future looks bright. There are now on the horizon new, more effective, more specific, less toxic neoadjuvant and adjuvant treatments, and that really is going to depend on the molecular genetics of the cancer rather than what's happened beforehand on the histology. So we're going to be looking at individualised treatment of patients, and that is very hopeful that's going to improve our patient outcome and survival. And just to sort of emphasise at Oxford, I think this is where we can sort of be in front in the investigation and treatment of sarcoma in the UK with this amalgam of the university and the NHS. Thank you very much.
Sorry, my name's Jeremy Fabak, and I've rather let you down by being late. person can't be here, so I said I would do it, and I failed to. Anyhow, that's a super talk, isn't it? And, do you think perhaps one or two questions
yes,
before
please.
we move on to the, because I think Jeremy's line is slightly different, isn't it? Are there things that people would like to ask about?
It's a very boring question, but I'd just love to know which hospital in London, or there were two, are majoring in this now.
Yeah, the Royal National Orthopaedic that tends to the bone tumours.
Queen's Gate, right.
And not really. And then it's the Royal Stratford, the Royal National Orthopaedic, and then Royal Marsden does a soft tissue sarcoma. Queen Square would get involved in maybe some of the spinal work, maybe the they say spinal work. But it tends to be over a big area of London where I think in Oxford we've got geography to allow us to work very closely together.
But we don't have them in the brain, do we? These sarcomas occasionally. I mean, that would be quick.
We've had 3 in the heart the last couple of months. So sometimes the rare areas.
I have a custom endoprosthesis done. How would you know what size it was? Nobody told me.
Yeah, I think we used to have to plan what type of endoprosthesis we used to do. Send X-rays up to the manufacturer, and they used to make them up depending what the X-ray, the size of the X-ray. We've changed over the last 10 years. We can now actually have off-the-shelf prostheses where we have a whole range of different sizes, literally in our operating theatres. And we have trials that we can literally fit in like sort of building blocks to decide which is the best fit. So we don't have that long turnaround before we actually do.
Oh, I know that. I meant, how would I find out the size of the sarcoma?
The size
You're
of
saying if your sarcoma is a certain size, you've got plenty to worry about. I don't know what size mine was.
Well, that's yes. That's done in the that tends to be done after we've taken it out when it gets measured up by an isosologist.
Who would tell me?
It would be the surgeon treating. That's what we tell patients.
Now you're armed with a new question.
There are websites out there where you can actually put in a number of your parameters of your sarcoma, the grade, size, histology, and then that will tell you what your predicted survival is.
Thank you. What, 2 years to your speech?
If you are going to be appointing molecular geneticists and you're working with Adrian, I'm assuming that you're thinking about doing some early phase work as well as phase 3 trial works. Is that right? Have you got any kind of early phase trial projects that you're thinking on the horizon?
About to sign my colleague, he's working with the various different companies on that. And he's working in the lab on molecular sort of studies and just assessing them at this stage. But I'm sure he's talking very good about that. I think it's not, I have to hold my hands up, it's not my expertise. I'm just reflecting the work that he's putting into the human.
I mean, there are a lot of trials going on there, and certainly in these sort of rarer tumours, clearly they've got to involve all the centres, and I don't know how many trials there are running.
Enormous. And the trouble with the rare sarcoma is that the number of cases are going to be low, so the costs are enormous.
Yeah.
And we're looking at that patients now who need osteosarcoma, extra drug for osteosarcoma, it's £150,000 a course.
Yeah, I should admit, I'm a member of the TIAC Research and Registration Group, so I've got kind of particular interest.
There are all sorts of people who have invested interest of some sort or another.